I grew up like dancing and ice skating, right? So I think wear and tear over time, right? With, you got blades on top of ice, on top of concrete, and I was a big jumper. Probably didn't help. I danced all the way through college until like my knees gave out. And then after that, I would just hit the gym. And I didn't do high impact. Like I did a lot of kickboxing. I lifted a lot, but then like when I would hit the treadmill, I would jog. And so I think over time that just kind of wore on me. When I got to the point where I literally had to take my hands and cross my leg, I'm like, okay, that's not normal. My hip flexors and my piriformis would always get tight, right? So I figured a lot of it, again, is like muscular around that area, but come to find out, I think what it was doing is probably protecting what was completely off in my hips. I went to another ortho and they said, well, you can move around like Gumby. And so until you're in pain every day, we're not going to do anything. And the part's only going to last about 15 years anyway. And so you'd probably need to do it again. Probably within about a 6 to 12 month window, I'm like, I've got to do something else, right? It's now impacting my, day to day. And so I had reached out to a close friend that actually had both of her hips replaced, and it was Dr. Shields.
I'm a joint surgeon here. I did a fellowship. I'm in a hip and knee reconstruction. I am one of 3 of our fellowship trained joint surgeons here at Atrium Health, Wake Forest Baptist, and all we do is hip and knee replacement. What we find is that if you're in a really good physical shape, that you actually tolerate a lot more. And so her hips were pretty terrible. And what we say, having a hip, it's not a heart attack, it's not a stroke, it's not something that you have to have done, but it is a quality of life. And you're having that pain that you live with every day has a huge impact on your quality of life.
I shared with him what, I was told previously, and I said, I kind of hesitated because of what the previous ortho, doc said, like it's only gonna last this long. He goes, if my hips look like yours and I'm 40, he goes, I'd be getting new hips. And he said, hey, they could last 30 plus years. I immediately got the right one, which was done first. And then, 4 months later, I got my other one. So I got, both hips replaced within a 4-month window.
How I did her hip replacements, I was a minimally invasive tissue sparing posterior approach. After surgery, there are no precautions whatsoever. Not a lot of tissue damage. As patients hit the floor, you actually get them up and get them moving on the same day. And a lot of our hips, are going home on the same day.
I don't really have much pain at all. I mean, in terms of movement or anything, like I can stretch probably better than I could before without pain. Sometimes I can stretch easier than I could, and there's just not the pain there. I feel great. I mean, glad that I did it when I did. I've made my adjustments. Now the Peloton, obviously I do a lot, which is not high impact on my joints, and so I'm gonna make them last.